reminder, the board approved the proposed regulations on February 21st, 2023. Those proposed regulations were published in the Maryland Register on April 21st, 2023. And that's when there's that public comment period. The public comment period closed on May 22nd, 2023, and there were no comments to the amendments. The next steps, if the board votes to adopt the amended regulations as proposed, there will be a notice of final action, and final regulations will be published on June 30th. And the board will then execute a delegation letter and hearing agreement. And as you know, Assistant Attorney General, we already spoke about that. That has already been negotiated with the OAH, so that's ready to go. And the regulations will be final. The amendments will be final on July 14th. There's a 10-day kind of waiting period, so that's why there's that gap of time. And then there is a proposed motion. The staff requests that the board adopt the amendments to COMAR 143510 as proposed, and to publish the amended regulations in the Maryland Register.
Do I have a motion to adopt the amendments to COMAR 143510? I was reading from our COMAR, not from MHBE. So do I have a motion?
I'll move.
Second. Board Member Allen. Board Member Bahrain made the initial motion for the record. Discussion. All those in favor?
Aye.
Opposed? The ayes have it. You have your regulations for publication.
Very good.
Good. Let's move to the young adult subsidy, and Johanna's going to present the final parameters of the proposed regulations. Go ahead.
Thank you. Get my slides. There we go. So some of this is background that will be familiar to many of you, but wanted to go over some background since we do have a couple of new board members here. So House Bill 814, which passed this last session, extended our previously 2-year young adult subsidy pilot program for an additional 2 years. So instead of running 2022 and 2023, it will now continue in 2024 and 2025. There were no other changes from the original bill beyond the 2-year extension. So the provisions of the original bill continue for the next 2 years, including that the board has the duty to establish the eligibility and payment parameters for the program within boundaries established in legislation. So individuals eligible for this program can be between the ages of 18 and 40. It can be a narrower band than that, but not beyond age 40. Individuals can be under 400% of the federal poverty level and not Medicaid eligible. The extension also maintains the $20 million per year in subsidies that may be provided pursuant to this program. So the board established parameters for 2022 and 2023. We didn't really make changes between those 2 years, just a little tinkering, but the substantive parameters maintain the same. So they're recapped here. Eligibility was 18 to 34, so 18 or older, younger than 35. So we didn't go up to the full age 40 that's authorized under the law. We were targeting those younger ages where there's even higher rates of uninsured, and also we're being mindful of that $20 million a year cap. So we're concerned at the outset of the program that going beyond age 34 could push us over our funding limits. Income, as I mentioned, adopted the statutory limits of under 400% federal poverty level and ineligible for Medicaid. In addition, someone had to be enrolled through Maryland Health Connection. And as a reminder, the board had and has the authority to cap enrollment if we anticipate that we're about to hit that $20 million a year threshold. So what that would look like would be, we would say, you know, we're constantly projecting forward our spend under the program. So we monitor our data regularly for that. If we anticipate that we're getting close to $20 million through the course of the year, we would come to the board and ask the board to consider capping enrollment so that people who had received the subsidy would continue to receive it for the rest of the year, but anyone newly enrolling would not receive the subsidy. We haven't even had to think about that because we've been well under the $20 million limit. As a recap on how we designed the subsidy, the most generous subsidy currently goes to those 18 to 30, and then it phases out over the 4 years from ages 31 to 35. And the way the subsidy works is it builds on the way that the federal premium subsidy is constructed. So under the federal subsidy, individuals have to pay a specified percentage of their income, and you can see that under the federal expected contribution column. So people are expected to pay between 0 and 8.5% of their income for a benchmark silver plan. And if the plan costs more than that percentage of income, federal subsidy makes up the difference so that you only pay up to your specified percentage of household income. The way the Maryland subsidy works is we reduce that specified percentage. So for example, and we reduce it by, you can see along the top under the age brackets, that's the amount we reduce it. So for 18 to 30, we reduce it by 2.5%. That fades out at 0.5% increments until by the time you reach age 35, you would not be receiving any state subsidy. You would only get whatever federal subsidy you're eligible for. And I think that those are all the key points there. So as I mentioned, we have not approached the $20 million cap we did not approach it for 2022. We do not anticipate we'll approach it for 2023. Instead, our spending has been more or less around $13 million. So with the 2-year extension, we worked with MIA and our contracted actuaries to look at options for the board to consider as they think about setting parameters for 2024. And we specifically looked at if we wanted to get closer to maximizing what we can spend under the program, what could options for that look like? And we examined 3 possibilities. One, just maintaining the 2023 subsidy parameters for another year, so no changes, continuing the program as is for 2024. Option 2 was to extend eligibility for the maximum subsidy by 2 years from currently 18 to 30 to 18 to 32, and then continue with the 4-year age out. Or option 3, extend maximum subsidy eligibility for 3 years. So maximum eligibility would be from ages 18 to 33, and then a 4-year phase out through age 37, with age 38 then being the year at which you're no longer eligible. So you can see the kind of graphical representation here with the maximum eligibility in green, the phase out in yellow, and then ineligible for state subsidy in gray. We looked at several dimensions of what these different options would mean. So you can see the top column is no expansion, and we have 2 tables here. So I'm referring to the top table. The middle column of the top table is what is listed as 2-year expansion, meaning expanding maximum eligibility from 18 to 30 to 18 to 32. And the third scenario is a 3-year expansion, expanding that maximum eligibility to 18 to 33. And so if we do no expansion, we just maintain our 2023 parameters for 2024, we anticipate that there would be obviously no new enrollment due to subsidy expansion, because this column that I've highlighted is highlighting how many new people we would attract into the market because of the change in the parameters. So if we did the 2-year expansion, up through age 36, we anticipate that we would see an additional approximately 1,500 young adults enter the market. If we did the 3-year expansion, that would be an additional approximately 2,100 young adults enter the market. These are individuals who we anticipate would not enroll in the individual market, but for the subsidy. So the subsidy is bringing them in. And in terms of what we look at what the cost would look like for these options. So if we maintain current parameters, the top option, we anticipate spending about 13 million next year, so pretty consistent. The medium expansion option would be about 16.5 million. The 3-year expansion option would be approximately 18 million. So all of these come under the 20 million cap, I think, with a reasonably comfortable kind of buffer still. The board voted at the May meeting on proposed parameters for public comment, and they adopted the staff recommendation, which was to go with option 3 to expand the maximum subsidy eligibility for an additional 3 years. We put those out for public comment. We received 2 public comments, one from Kaiser, one from our advocates at Maryland Healthcare for All. Both were in support of the proposed parameters, the 3-year extension. And so now we're asking the board to vote on those final parameters. And our staff recommendation would continue to be that we go with that 3-year expansion, option 3 that I had described. And so with that, I'm happy to answer any questions.
Any questions? Board? So do I have a motion to approve option 3 as the final 2024 young adult premium subsidy parameters as presented by Johanna?
So moved.
Second. Second. Board member Singh, seconded. Board member Esther should the original.
All right, thank you. I'll skip through my appendix slides. And then,
Still have to.
oh, sorry.
Any questions? If not, all those in favor?
Aye.
Opposed? Go ahead.
Thank you.
And you will report next year on those estimates of whether we got about 2,100 new enrollees. I think
Yes.
the board would like to know the precision of the contract actuaries estimates.
So would we, yes, certainly. So one other agenda item for me also on the young adult subsidies, the 2-year extension in the bill. So that's the program extension for years 2024 and 2025 necessitate one minor change to our regulations regarding the program. So the current regulatory text you can see here, we had just specifically called out that the board had authority to set payment parameters for 2022 and 2023. We're proposing to revise that to take out that reference to specific calendar years and just have general language about in any year of the program, so that if it is extended in the future, this will continue to be correct language. So other than that, there were no changes to our regs that were needed by the extension. This is the only place where we had happened to mention specific years. So pretty small edit. We put these out for our typical informal stakeholder public comment period. Unsurprisingly, we did not get any comments on that minor change, but we're here to ask the board to vote on the proposed action, which would take us through this timeline with the end point of the regulations being effective in October.
We have We have a motion to adopt the proposed young adult subsidy regulatory updates as presented and authorized by the MHBE to submit them to the ALR committee for review and then publication by the Division of State Documents in the Maryland Register early next month. A motion.
Brain.
Commissioner Brain made the motion. Second. Commissioner Allen seconded. Board member Allen seconded. Sorry. All those in favor?
Aye.
Opposed? Joanna. Now we have a set of IT issues. IT procurements, Venkat and Sherelle, will present.
Tracy.
Tracy, oh, yeah, Sherelle, sorry. Tracy is presenting. Yeah. Tracy Gamble.
Good afternoon, board members and everybody. I'm Venkat Kaushal, Chief Information Officer of the exchange. I'm joined by our procurement manager, Tracy Campbell. And we are looking to request the board to approve 3 core software that the exchange currently places. One is Informatica Power Center, the second one is Akamai, and third is Corticon. I'll give a very brief overview and then I'll hand it over to our procurement manager. The Informatica Power Center is a critical data integration solutions software. We utilize this software for various data integration, data translation, extraction, reporting purposes. However, in this particular software that we are requesting is specifically will be used for building our disaster recovery capabilities. As the board is aware of and approved, we've been continuing to build this capability outside of MD Think platform, and we hope to continue this in this direction. Hopefully, we'll have a good disaster recovery system by the end of this year. And I will hand it over to procurement manager.
Good afternoon, everyone. We actually issued an invitation for bid for a 2-year period to start June 27th, 2023 to June 27th, 2025. We actually want to award to NJ3Q Technology LLC. And the cost for a 2-year license is $306,358. For FY24, the cost is $147,290. And for FY25, a cost of $159,068. Are there any questions in regards to the procurement method or?
Say it's FY23 and FY20 as it starts June 27.
I'm sorry, FY23, FY24. Thank you.
So I'll make the motion to approve a contract to NJ3Q Technologies LLC to procure an Informatica Power Center license subscription for the period from June 27, 2023 to June 27, 2025 in the amount of $306,358 with a federal participation amount of $200,196.28 and state participation of $104,161.72. Do we have a second? Second. Board members saying second. Questions? I had one question, and you mentioned that how is the disaster recovery capabilities going to differ as a result of this contract? Is it a continuation of what we have now?
Thank you, Mr. Stefan. Actually, the disaster recovery site that we are building is outside of the MD Think platform. That's going to reside on our AWS, meaning the MHBE's AWS system. And in order for us to build the exact capabilities that we currently have, we need to procure these additional software licenses to build these disaster recovery capabilities. Thank you.
Other questions? If not, all of those in favor? Aye. Marie, did you have a question?
No.
Okay. All those in favor?
Aye.
All those opposed? You have your contract.
Thank you. And the second software that we are requesting here today for approval is Akamai. Akamai is a product suite that the exchange has been using since our inception, actually right after our second exchange. And we are utilizing this for regulating the traffic from our web and mobile platform, as well as the software provides a variety of security optimization and the waiting room capability during open enrollment otherwise. And also we do utilize the software for monitoring various performance. And after we have moved to cloud, we are utilizing the same software for monitoring cloud efficiency as well. And this is one of our core system that protects the exchange before the traffic reaches into exchange core systems. I'll hand it over to Pretty.
We issued another invitation for bid for the Akamai renewal for a term of July 1st, 2023 to June 30th, 2025. The cost for the 2-year license for the total 2 years is $915,360.24. We're showing a cost comparison from the previous contract of $915,031.68. The cost for FY 24, Tony, is $457,680.12. For FY 25, $457,680.12.
And this is a quick comparison of the variety of products, listing of variety of products that we use. As you may have noticed, the cost was almost same in spite of the escalating costs in this environment. The reason for that is we continuously revisit our licenses and tweak based on our utilization, so we could keep the cost almost the same as in the last 2 years.
So I will make the motion to approve the contract to Carousel Technology Corporation to procure Akamai license subscription for the period from July 1, 2023 through June 30th, 2025 in the amount of $915,360.24 with the federal participation of $604,135.76 and state participation of $311,222.48. Do I have a second? Board Member Crandon seconded, and questions? Hearing no questions, all those in favor? Aye. Opposed?
Thank you.
Go ahead, Venkat. Thank you.
Thank you, Leila. The final software today is the Corticon. Corticon is a business rules engine that we have integrated into our exchange that pretty much transfers all our policies into rules to the programs, and including Medicaid, UHP, and CHIP, and dental, and all rules are integrated into the system. This is one of our core system. We are procuring this for our core system. This is a 2 years contract. I hand it over.
We issued a third IFB for a 2-year period of August 1st, 2023 through July 31st, 2025. And the awardee is Axletel Inc. The total cost for the 2-year period is $876,712. The cost for FY 24 is $438,356. Cost for FY 25, $438,356.
And as above the previous software, also we continue to tweak this software, and we are able to keep the cost pretty much around the same level compared to previous years, and we will continue to do so as well as we evolve from here.
And again, I will make the motion to approve the contract to ALXtel Inc. to procure Corticon licenses and support for the period from August 1, 2023 to July 31st, 2025 in the amount of $876,712 with federal participation of $578,629.92 and state participation of $298,082.08. A second. Second from Board Member Crandon. Oh, Dana, excuse me. Any questions? If not, all those in favor? All those opposed? You have your Court of County license. If I could, Venkat, maybe to, for the new board members, we do an awful lot of IT procurement, and maybe it would be helpful if they had an opportunity, kind of an overview of the infrastructure that you and your team have developed over the last 7 or 8 years at their convenience. But I think it kind of get a better idea of what you're approving if you have a view of what the entire infrastructure looks like. Is that acceptable?
Sure, Mr. Sir, will be.
Okay.
Thank
And
you.
I would like to also add, if the overview could include Maryland Think, how that plays into it, because they weren't here for the discussions about Maryland Think and what it is. And
We can definitely provide an update how we integrate with Maryland Think, and well, it would be not necessarily for you details about MD Think, which I'm not really too knowledgeable, but definitely we can talk about how our exchange is integrating with MD Think, and definitely talk about common software and how we are utilizing MD Think platform as well at this time.
Good news is I've been a tech executive too in a prior life, so many of these I'm familiar with. But I would appreciate understanding, have a full understanding of all the work that you've done over the last 7 or 8 years. Thank you.
Yeah, thank you, it's my pleasure.
The ubiquitous Maximus contract modification is now before the board. Tony, you give me the presentation. And Tamara?
Yes.
Join me.
We're here to go over the Maximus fifth modification, public health emergency unwinding cost. I'll let Tamara go over the meat of what's in it, and that's on the next slide, and then I'll go through some numbers, and then we'll have a motion.
All right, thank you. Maximus contract specifies agreement on compensation of the PHE unwinding costs. This cost was sent to, this cost was sent to MDH and was approved by CMS. This cost is for Maximus to maintain a minimum of 190 CSRs. That would be for the call and chat support duration through the PHE unwinding. MHBE will compensate compensate Maximus for the upscale in training and staff, which will be 190 CSRs. This is because it's outside of open enrollment scale up. MHBE will compensate for overtime costs because the call center is now open on Saturdays from 8 a.m. until 2 p.m. MHBE will pay monthly robocalls targeting customers who have not yet renewed their coverage. Additional compensations and excess staff if call center volume forecast is met. Occupancy rate is less than 84.5%. MHBE has agreed to pay for licensing costs for staff over the minimum contract amount of the 150 that's in the prior contract. Additional compensation to maintain 190 staff for the cost of volume if the cost of volume falls below 5% of the forecast volume.
Thank you. Just to let everybody know, as far as how this falls in with the budget, this additional cost that we're going to have in FY23, plus the actual cost that we've incurred so far, is going to be less than the NTE that the board approved back last year, and it will the FY24 cost was included in the NTE amount that we came to the board and requested back, I guess that was in last month or April. So as you can see here, the costs, I mean, the top costs are for the top 6 costs are for personnel, The next two are for specialized items. The monthly license cost, the total cost is $2,399,632.82 for the modification. And any questions as far as the costs? Yes, sir.
So, if the unwinding continued beyond September 2023, are there funds in this budget change modification to cover that, or would you need to come back?
We need to come back. So,
I just had a short one, and I don't have an issue, but it's just more for clarification and understanding. So, it talks about, amount for below forecast risk. Can you just explain what that means?
Below forecast, so, we have a certain amount of calls, that the consumer, that the Maximus is responsible for. So they have a staff of, 190 people. They have a whole bunch of call outs, right? We're not gonna pay, for them to have a whole bunch of call outs. We're paying for them to answer the calls. So that's what it's for them to answer the calls. So if they're below a certain point, we're only gonna pay at a certain point.
This says we're paying $500,000 if it falls below.
If it's below the 3,000 calls, and this is for 5.5 months.
So this, I'll add a little bit to this. This is part of when we talked to Maximus about scaling up for public health emergency unwinding. Because we had nothing to base this on, whereas in the past, when we do look at our forecasts, we have historical data. We had nothing to base this on. And so Maximus' concern was, well, we're gonna scale up to these 190 people and we have to pay them. But because we pay them on a per call basis, if the calls came in very low, they were at risk. We're now having to pay those people and the calls didn't materialize. So this was a way to say, and I don't think it's come to fruition, but it was a way to say, if you overstaff and the calls don't come in, so you're not getting that per call amount, we will help take that risk out of the equation. So we would pay you as if you got calls.
And right now, we haven't even used that because they have not utilized it
Does
yet.
that make sense?
It does, but, and I can ask you the question offline because I'm not gonna, it seems, is it that whether it's truly additive because it's conditional, but.
Any other questions?
No further questions.
And this, just to clarify that, this is the cost of this contract not to exceed. It doesn't mean we're paying that out, that full amount out. Right, Tony, confirm that?
I'm sorry.
So this contract amount is the not to exceed contract amount.
yes.
It doesn't say we're gonna pay that. It just is conditional, as you said.
And the actually motion didn't make it, but it's in your handout.
Yeah, it's in the handout, Tony, that's fine. So I will make the motion. I move to approve the fifth modification to the Maximus contract to maintain 190 CSRs to support phone and chat services during the public health emergency unwinding period from April 1 to September 30th, 2023, and to compensate the contractor according to the fully executed change request for an amount not to exceed $2,399,632 with the federal participation of $1,799,724 and state participation of $599,908 as presented. Do I have a second? Board member Allen, thank you. Questions? That, all those in favor? Opposed? You have your contract modification.
Thank you.
Good luck to you, if Maximus is on the line. Good luck, with this, important unwinding. Now, Andy here. Andy's gonna, give us a review of the, 2023 FY
Well,
2023.
before you start that, so I'll just take a moment
Okay.
and then we can finish with that. How's that? So this is our annual meeting. Every year we have a designated annual meeting and this is it. So thank you all for being here today. We thought we would have just a really nice kind of wrap up from the last year of, you know, some of the accomplishments and things we achieved. So that's what you're going to see. And many thanks to Andy for facilitating this, for Tim Cook, who put it together. We think it's pretty neat. And I would just want to thank all of you, our board members, our current, long-term serving, brand new board members, because the work we do, we can't do it without your input and your support, and your guidance. So we really appreciate the time. We know this is volunteer work for you. We know that it takes a lot of time, and we appreciate the guidance that you lend myself and to the MHB and our entire team. And after we close, we'll show the video and then we'll close out the meeting. But we will go just 2 minutes down the road to Mother's Peninsula Grill, and we'll have some food there and we can have a little after meeting celebration. So thank you all again. And with that, we can kick off the videos.
Andy, when is the full-length movie coming out? Clear, but better than some I've seen on Netflix, I'll tell you. With that, just because we have new commissioners here, I want the staff to stand up, make sure that everyone, the new commissioners know who the staff here that put this together. So if you wouldn't mind, staff, please stand up. So you all. These meetings are quite an undertaking. And the bringing together technology in a new place is oftentimes challenging, and it went on flawlessly. So thanks a lot to everyone for the work. With that, I'll entertain a motion to adjourn.
Seconded.
Second. Thank you very much, board members and staff.
So I just want to make an announcement. I just want to make a quick announcement, just, and I know all the board members know, but this is a purely social event, no business can be discussed, policy, otherwise, really just to get to know each other on a personal level. I said it, so.